There's this notion out there among people that know a lot about borderline, which is not a lot of people, which is that it's like a trauma-based diagnosis. And while I think people probably do respond traumatically, for me, I didn't have that in my life, so I couldn't really look to that as something to blame. Capital T trauma, which would be like no physical abuse, no sexual abuse, no major life events that would be deemed like sort of empirically traumatic. So that just totally did not happen in my life, really. I'm not in a position to sort of talk about like what causes the diagnosis. I don't feel comfortable doing that. But what I can say is that I did find in doing this film, I stayed away from people talking too much about their traumas. And the reason I did that was because I didn't want the audience to be like, well, this person was beaten, therefore they're this way. Because far more people are beaten and don't end up with a borderline diagnosis than maybe do. So you can't reduce the diagnosis to this trauma. There's no doubt that it might trigger things, but it is not, I don't think, you certainly couldn't look to that as the cause. And so I really didn't want it to be oversimplified. So, the danger of using trauma as a sort of guide for why a person is the way they are, or why they're this or why they're that.